Hi everyone, my name is Dr. Nivi Manokaran and I will be going live with Safe Space today. And we are going to talk about everything STIs. And that is very important because people just think, treating an STI or diagnosing an STI is as good as any infection. So they feel like you diagnose the STI, you give antibiotics, you treat it, and then people are fine. Usually, treating or diagnosing STIs are a little bit more complicated than what people think treating infection is, and I think that is very, very important. So today I'm going to talk about STIs and everything around STIs with Safe Space. So there has been a technical glitch with Safe Space. So my voice was constantly echoing with Safe Space. Hello, hello, hello everyone. Hello Krishna. Hello Priyank. Hi Daddy. Hi Deva. So there's a lot of people there. Thank you so much for joining me today. And hi Dominic. So I'm just going to wait for the host who is Safe Space. So I think Devika, I think you have to, I'm going to view the request. I'm going to add you. So Devika is actually the host. So she'll be taking over once she joins the live. So yes, I'm just waiting for her to join. There we go. Hi, Devika.
Hi, doctor.
Perfect.
I guess
I
now.
think this is great. I think the audio
Yeah,
is perfect.
finally.
No
Yes.
worries. I'm going to leave it to you. So you can start off again if you want to, and we can take it from there. Okay.
Okay, I guess we should just start it like ekdam fast. Like it's just a very short, like you can just answer it real short this time.
Absolutely.
Yeah, sure.
Let's do that because you want it recorded as well, and I think people want to hear it clearly as well. So let's get to the point.
Yes. So the first question was, if any adult who has an active sexual life wants to undergo a certain screening test without showing any kind of symptoms and wants to know if he's been infected or is an asymptomatic carrier of STD, they have to undergo one certain screening test or they have to undergo multiple screening tests?
Perfect. So screening test is very important. What test a person has to undergo depends on what they have or what kind of sex they have, or are they using protection or not, and things like that. And that is why asking specific questions is very important. Sometimes when you go to a doctor and you feels like they're digging into your sexual life, but those questions are important. They want to know whether you're having vaginal sex or anal sex or oral sex. And depending on all of those questions and who you're having sex with, men or women or trans, all of these things, it is very important because depending on that, your risk increases. And depending on the risk, we also recommend tests. So it is not like a one test that everybody can do. So depending on, again, like I said, there is urine test, there are vaginal swabs, there is throat swab, there is rectal swabs, there are blood tests for STIs. So there's a whole panel out there. So it's very important to know what this particular person's exposure and risk is. And depending on that, we can offer the STI testing.
Okay, thank you so much. So the next question is, in India, are these tests available in the government hospital or there are certain specific clinics designated for this test?
Perfect. The tests are available in government hospitals, definitely. So, like I said, dermatology has a part of it called venereology, and venereology is nothing but sexual health medicine. So if you go to a dermatology department in a public hospital, in a government hospital, definitely they will have STI testings, and they have a department for testing STIs and HIV and whatever it is. But venereologists are not the only people who do STI testing. STI testing can be requested by your GPs, general practitioners. STI testing can be requested by your gynecologist. It can be requested by infectious disease specialists. It can be requested by a whole range of doctors. Actually, like I said, skin specialists and people who take care of vulval area and genital skin and stuff like that. So there's a whole range of specialists who can actually access or give you this test. Like I said, unfortunately in India, only because we are only now starting to talk about sex and the need for sexual health and reproductive health to be more open and more out there, I guess we still do not have sexual health clinics, specific clinics, which I think in the future will be something that we will be looking into, and having sexual health clinics, definitely.
Okay. So doctor, can we conclude that an adult who is 18 plus, irrespective of their gender, can approach an healthcare professional without a guardian or a partner and undergo screening?
Perfect. See, it's a good question because yes, they should be able to, but are they able to in India is the question, I think, right? Because it's a it's a bit
Exactly.
tricky. So if somebody is 18 and they want to go and get tested, forget testing, even if they want to go and get contraception, they should be able to go. They should be able to go and access a healthcare provider and tell them, you know, that I'm interested in contraception, what are my options, without having to be judged, without having to, you know, be ask the question of are you married or not, or without you know, having the question of who have you come with, any of that. Because, you know, I think it's time we accept that people really, you know, in a young age, from the puberty till the time they're getting married, they're all sexually active. And if we start, you know, embracing it or accepting it, then we will be able to provide care. And I think that is very important, the point that you brought now. I can't for sure say yes they can, because I feel that in India, it's still a big taboo, you know, it's a bit of a struggle. People are still finding it extremely hard even to go to doctors, because doctors also have grown up in the same way. They have a similar, you know, I won't say mentality, but true though. So I think it makes it very challenging. So I think it's very important, even in medical field, for us to unlearn what we have learned over the years and have a new attitude and a helping attitude rather than a judgmental attitude towards youngsters is very important.
Sure. Okay. So, Dr. Nivedita, now there are certain STDs such as herpes and syphilis that are not necessarily transmitted because of like through sexual intercourse or transmitted from mother to child. There are ways, other ways through which they're transmitted. So, what would be the precautionary measures, or what would you suggest in these cases?
See, I would tell people, you know, when I tell people use a condom, it prevents STIs. I always use the word most of the time. And I never say all the time. The reason I say most of the time is, like you said, there are some STIs like herpes or warts, you know, and what viruses and stuff like that, which are viruses which exist in people's skin, and it spreads through skin to skin contact. And I think that is very, very important to know, because you may be someone using condoms 100% of the time. And then, you know, people usually get frustrated because it's, I used condom all the time. How come I had an STI? So I always tell people STI prevents you against 90% of the time. So the 10% of the time, there are some STIs that occur through skin to skin contact. And you have to understand that if you are sexually active, you know, and especially if you're having like a few casual partners, there is always a risk of acquiring some viruses like this, which you cannot prevent from getting when you're sexually active. And the reason I'm saying that is, you know what, it has become really easy since the COVID to explain this whole viral situation, you know, because these viruses act exactly like how COVID. People have it and they don't know they have it. People can carry it and transmit it to other people without knowing that they're transmitting it. Some people get symptoms, some people don't get symptoms. Exactly like COVID, right? All these STI viruses behave exactly the same way. So it's not like people genuinely know that they have this virus, because it's asymptomatic. And then when they're having sex and they're transmitting it, one of the person that they're having sex could actually have, you know, a symptom. So, you know, that is very, very, So it's very important that people understand how these STIs, some STIs that you're saying is transmitted. And you also mentioned mother to child transmission. There are some STIs which can transmit from mother to child, for example, syphilis, or for example, hepatitis B, HIV, and things like that. And I think that is why in many countries, including India, they have made prenatal, or as we say, antenatal testing for these STIs very mandatory, because it is very important to find out that women are clear of these things before they're actually giving birth to the child. So it is very rare. I think, I don't know how, you know, there are rural parts of India and stuff like that, but I feel like most of the time healthcare and pregnancy has now become a very gynecology or doctor oriented stuff. I think hardly people do home delivery and not take care of their, you know, antenatal time and stuff like that. So most of the places it has become mandatory that people have these STI testing before they are pregnant, or even when they are pregnant, so that they can get treated. Even syphilis, you can treat them when they are pregnant, so that it is not transmitted to the baby. You can treat for hepatitis B. You can also treat for HIV, so that it is not transmitted to the baby. So the science have really come a long way. So getting tested during or during a pregnancy, or in fact before you fall pregnant, is actually a good idea. So by doing that, you prevent these STIs from happening as well. That's very, very important. Sorry, the audience want to know if we can ask questions. Yes, you can go ahead and type your questions in the comment box, and yeah, we will answer those questions in the end. Thank you.
Okay, so doctor, this is going to be the last question from our side. So there is a lot of stigma around STD, right? About how an individual should lead their sexual life, whether they should start a family or not. What's your take on this whole thing? How do you think the youth should approach if they are suffering from sexual health mentally, and also the way they lead their sexual life?
Right. Sorry, you said in the question you asked me something about family. What was that?
Whether or not they should start a family. There are many people who believe that we have an STD, we should not have been having kids, or
like that, right?
Yeah,
right,
that
right.
yeah, that way.
Yeah. No. With all kind of STIs, yes, you can definitely start a family or have kids or get married, or it doesn't matter. I think the point here is STIs still have a bit of a stigma, but I just want people to understand it is like any other infection in one part of your body, which is your genital areas. Let's just say like that, okay? It's transmitted through sex, and that is all it is. But all the STIs have testing. All the STIs have fantastic treatment and management plans, including HIV. Most of the time people those days used to think, if I have HIV, my life is doomed. I can never get married. I can never have sex with people. I can never have babies. And we in research and science have actually changed that. So I really want people to understand, like, if you go and get regularly tested, and if you have an STI and it's been picked by regular testing, that is the best thing that can happen, because most STIs have treatment. And for some STIs, like let's say HIV, there is no complete cure. It doesn't go away, but definitely there is such fantastic treatment which makes your virus almost less than 20 virus in your system, so that you can actually, it's called an undetectable state. We use the word undetectable. And if you become undetectable, you can actually get married, have unprotected sex, and you will not transmit HIV to that woman. And the woman can fall pregnant, and you can have babies who are also negative. But the moral of the story is you should have gotten tested frequently if you feel like you're having unprotected sex and you're not using condoms and you're seeing high-risk people. Get tested. And I think that is the moral here, because once you get tested, all the STIs have great treatment, and treat it like most of the STIs is like a cold or a cough or a fever or a chest infection. You have an infection, you treat it, you just move on. Just because it is acquired sexually, you don't need to, sex is a very important thing. It's a very natural phenomenon. People do it all the time. There is no need to actually, you don't feel guilty if you have a chest infection and you're taking antibiotics. It's the exact same thing. It's okay. It means that you're sexually active. But yes, we are all human beings. We are sexual beings. We are meant to have sex. So it's nothing to, So, and we reproduce. Look at the world. We are 7 billion, and out of that 1 billion is from India. So I don't know what they're talking about. Everybody is having sex. So if you accept it, and if you go and make sure that you don't have any infections and stuff like that, that will be fantastic. So I cannot stress enough, right? Don't wait for symptoms. Don't wait for some kind of complication to happen. Don't be scared that, oh my God, what if I have an STI? Because, oh my God, if you have an STI, you'll be treated. And how are you going to know whether you have an STI or not? Please go get tested. So don't stop yourself from get testing, because testing is the best thing that can happen with STIs, and that's very, very important.
Okay. Thank you so much, doctor. So I guess there was 2 questions regarding which is the best contraceptive method, and is STI possible through kissing and cuddling?
Okay, perfect. So first thing is, I'm going to talk about this. Is STI possible through kissing and cuddling? Look, again, I think it comes down to skin-to-skin contact, if that is what you're talking about. So if you're kissing, and let's say somebody has herpes or something, it's called the cold sore or oral herpes or something like that. Yes, if people are carrying it or something and you're kissing, yes, especially if people have sores and you're still kissing, the chance that you're transmitting is much more likely. And so those kind of things can transmit. And let's say they're having oral sex and they're going down on you, and then this cold sore can get transmitted in your genital area and you can have genital herpes. But honestly, the cold sore is like having a cold. Most of the population have, 50% of the population have cold sores. And because there's a lot of oral sex involved, people get cold sores and stuff like that. So if we talk about things like that, yes. Look, cuddling, again, it depends on how people want to define cuddling. So I think if you're going to go and give people a big hug, I don't think you can get an STI. But at the same time, if you're going to a point of where, you're probably stripping your clothes off, you're in a foreplay mode, and your cuddling is a lot of rubbing of other areas, genital areas, and a whole bunch of things, then yes. So I think it's important to define cuddling. But yes, from skin to skin contact and rubbing, you can definitely, you can get STIs. I mean, am I going to get, like, not everybody who's going to have skin to skin contact going to pick up, but the chance, I want people to be aware of it. It's, I don't want people to say, I haven't had any sex and not consider all of this as a sex. Like oral sex, some people don't consider as sex. It's all about the fact, the virginity situation that is happening, right? Oh my God. But no. But that is well, and STI. Just be aware. Don't be scared. Just be aware.
Yeah, sure. Thank you so much,
Doctor. And the second question is, somebody asked me, what is the best contraception? Honestly, that is a whole live on its own. Contraception, because there are such amazing contraceptions that are available these days. Look, unfortunately, male contraception, you have only a couple. One is your condom, which is fantastic. The other is your vasectomy, where you have permanent cutting of your tubes, which hardly people do that these days. So I think in terms of male contraception, condoms are the best. Overall, I think condoms are best because it's the only contraception that has dual, purpose. It also prevents STIs and it also prevents pregnancy, and that is very, very important. Yeah, so I think condom is the only thing that does both the jobs. So if somebody wants a 2-in-1 situation happening, yes, you should go for condoms. So in terms of long-term relationships, or where you don't want to use condoms, but you also don't want to fall pregnant, there are 1 billion fantastic contraceptives for women. And I think it's a whole separate talk on itself. So I cannot particularly say what contraception is best, again, because contraception is again like your STI testing. I just can't throw one contraception on all people. There's no one. So I need to ask questions. I need to know what medical history they have. I need to know what other medications they're on, their allergies, this and that, before I actually suggest a good contraception for a woman. But to be honest, there are plenty. So definitely go and see a doctor, and I'm sure they'll be able to run through a whole bunch of contraception that's available for women.
Okay. Okay, so there is another question, which is something like,
I think it's finger penetration.
I guess, fingering,
that's right. Look, I mean, you can finger penetration alone cannot cause an STI. So let's say you take a clean finger, put it into someone, it cannot cause an STI, but it depends. Again, sex is always very complicated. I feel it's never an in-out process where things go in and come out. It's always a lot of fluid that's involved, a lot of contamination, and a lot of body fluid that's involved. So if your finger is going, let's say you're doing anal, you're also doing vaginal. So it depends on where you're putting your finger and how you're doing it. So even if it's just finger, if it's going through a few different holes and there is contamination happening, yes, you can get some kind of vaginal infection. You can get a urinary tract infection, because the E. coli is very common in the stool and bum area. And then if you're doing that and going to the vagina, yes, that is common. So fingering, yes, can cause infections, but not necessarily, particularly an STI doesn't come from the air if you're using your clean fingers straight away. But also sometimes during sex, when people are fingering, they also finger or touch themselves. So I want people to be aware of that. So that is a way of transmitting infection. So you touch yourself first, and let's say you have a chlamydia or something like that and you don't know about it. You touch yourself first, and then you go and touch the other person and you finger. The chance that you're transmitting chlamydia from your discharge or your secretion into their vagina is possible. but the other woman is thinking, oh my God, I didn't have any penetrative sex. It's only fingers, so I wouldn't get anything. But again, like I said, sex is never a very clear in-out, is it? There is a lot of fluids, a lot of kissing, a lot of saliva, a lot of other lubes or whatever that is that you're using. There's always a lot of, cross-contamination that is there. So I really want people to be aware that, even if it's fingering, it depends on where all the finger is going. So that's very important.
Yeah, exactly. Thank you so much, doctor. So yeah, I guess there is another question. Does it harm to partner to nipple suck during okay?
Yeah,
Or
so I think they want to know
baby,
when the wife is breastfeeding, if you can have sex, can you suck their nipple? I think it's okay. I think it's fine. It's not harmful, but honestly, breastfeeding can be very, very painful for women's nipples. Some people's breasts are really tender. Some nipples are cracked. They are red. Actually, sometimes it's even bleeding. It's not, it's not a very simple process so that is a question you actually have to ask your partner. So in case of harm, it is not really harmful for the baby, or it's not really harmful for the person either, because after that, if you're not going to clean up and then you're going to feed the baby, that's fine. But at the same time, if it is painful and if it's not okay, you definitely have to communicate with your partner as to what is okay and what's not okay during sex. And I think that's very, very important. Yeah.
Okay. I guess we are done with the questions from audience.
Perfect.
Okay. So, okay, there is another question, ma'am. What is dental dam? Yeah.
Right. Dental dam is a square piece of rubber which you use it when you're having oral sex. You can use it on people's vagina when you're going down in them, or you can use it on people's anal area when you're going down in them as well. It prevents infection from going either from your mouth to their vagina or from the vagina to your mouth. The same with the anal as well. So dental dam is literally, if you snip off the condoms on either side and cut it diagonally, you'll have a square rubber sheet, and you use that rubber sheet and then go oral on them, and that is what is your dental dam. And dental dam is actually a very fantastic thing to prevent the STIs or any infections when you're doing oral. So that is something that you could use if you feel like high risk, casual partner, you're not sure, but that's what you're going to do. Dental dams is something that's really helpful to prevent infections.
Okay. Thank you so much, Dr. Nivedita. Thank you so much. We're so glad and we're so thankful that you joined Safe Space for today's live, and it was a great session indeed, ignoring those internet questions.
No, I think this is great because I think I am recording this. I think I will have to share this, so I think I will tag you and share this, and then you can it's been a fantastic session, and I'm glad that and I really like to thank all the audience because they have been so patient through all the glitches, and again. And thank you for all your suggestions to make this live work, changing headphones or, logging off live and me coming live. So thank you for all the suggestions. It's been
thank you so much.
Great. Yeah, it's a great audience. So thank you so much.
Thank you so much, Dr. Nivedita. We'll hopefully see you again. Thank you from the whole team of Safe Space. And thank you, audience, for being so cooperative and so understanding. Thank you. Wish you all a great time ahead. Okay. Bye, Dr. Nivedita. Thank you so much. Thank you.
See ya. Bye.
See ya. Bye-bye.